Hi there, I'm Kim Orleck, a physician assistant in Atlanta Gastro, practicing in Atlanta Gastroenterology. The next question I'm going to answer is, what are some best practices to accelerate the timing of finding the right therapy for your patients with IBS-C? I truly think finding the right therapy honestly starts with confidently and accurately diagnosing our patient with IBS-C using this positive diagnostic strategy. I truly think this is one of the best shifts I've seen in my time as a provider in GI. This shift to positive diagnostic strategy decreases unnecessary testing, as well as it decreases the time to getting a patient a diagnosis. It decreases their financial strain. It allows us to give them that diagnosis faster and therefore also get them on therapy faster. Getting this patient a diagnosis confidently and giving them therapy as soon as possible will allow them to have increased confidence in us as a provider. Once we get them on therapy, we want to ensure we talk to them about the appropriate timeline. And typically I see these patients back in about 2 to 3 months, hoping that they're going to have an improvement in their bowel symptoms first, but also an improvement in their other global symptoms by the time I reassess these patients. If we see them back and they don't have a response, or they haven't really hit or achieved the targets or goals they want, we then need to think about another therapy. When deciding which therapy, we want to consider dosing, once a day versus BID, timing of meds related to meals, side effect profile, and of course, how this is going to work for each individual patient. It's also really important to involve our patients in this discussion. In addition to this shared decision-making, we also need to consider cost and coverage. Taking a really good history of each patient and what they've already tried and possibly not responded to, lost response to, or failed helps us to not reinvent the wheel. Also documented all these past tried therapies will help with coverage. Thank you for listening. For any additional information on this topic, please visit the GAP website. Please let me know if you have any additional questions. I'm certainly happy to help.